Well, urology is essentially a surgical subspecialty. It's one of the oldest subspecialties, and we deal with problems in the urinary tract. A big part of our workload, for example, would be stone disease. We deal with cancers of various kinds. Prostate cancer, I suppose, is the most prominent and the best known, but other tumours like testicular tumours, bladder cancers. We also deal with children's problems, congenital children's problems such as undescended testes. There's a collection of other things then, such as continence problems and male infertility and male sexual dysfunction.
I work in the specialty of urinary tract surgery in males and females. We would see the whole range of, in fact, not just urinary tract, but also genital tract surgery in the male as well. So we see quite a range of ages of patients, and obviously both males and females. In particular, I guess, a lot of our practice would be, males of a certain age who would have the kind of old age or older age related problems that men get. And hence the whole men's health subspecialty is to some extent centred around urology.
If somebody comes in with a certain problem, there's always another consultant at hand to help out if that they can't deal with it or they feel that it's not within their field. So they will just refer somebody on very quickly to have help with in the area that they need to have the help. So it's it's quite good that way, because there is quite a lot of consultants with different disciplines that will help out the patients.
A lot has changed in 20 years, as it does, and urological practice has changed in certain ways too. We're certainly seeing older patients, and the age cut-offs that we would have had before for when certain diseases would have been treated have changed as well. So that where, radical treatment for prostate cancer, for example, wouldn't have been contemplated over 65 years of age, certainly surgery, now we're actually looking at operating on patients who are considerably older, because their life expectancy has changed.
And we've just started up a group now around Cork, with the different Cork hospitals now, and so we're kind of discussing different cases and stuff like that, getting case histories. So we're learning all the time from each other, so it's I really enjoy that part.
I really found that everything that you needed to carry out your job to the level of what we call best practice was either there or made available.
You very rarely hear the word no, or we can't, or you shouldn't, or whatever. When we take a patient into the hospital and organise their treatment, everybody is there just for that patient, and there are none of the frustrations that I hear colleagues in other hospitals having to deal with on a daily basis.
So it's quite a tight unit that works very, very well together, and it needs to be that, because it means the patients, as they're encountering all these people, they're getting the same messages, and the next person knows what the last person has asked to be done.